All right, welcome. Today, we're going to jump right into a clinical scenario that's all about getting your skills ready before you even hit the simulation lab. This isn't just about what's in a textbook, it's about thinking on your feet. You ready to go?
Okay, you just got your assignment. Your patient's name is Anthony. He's a transgender man, and he's in active labor. Listen up. Before you even push open that door, your nursing assessment has already started. This is that moment to take a breath and get ready to provide some really great inclusive care. Let's do this.
So, first things first, you've got to make a connection. This very first interaction you have is going to set the tone for this family's entire birth experience. This is where you build trust and start gathering all that info, not just the clinical data, but the personal stuff that's so important for patient-centered care.
Think about it. You walk into that room, what are the very first words out of your mouth? How are you going to introduce yourself? And how do you make sure you're acknowledging both Anthony and his partner? Right now, you have a chance to create a space that feels safe, welcoming, and affirming. So, what are you going to say?
Okay, so you've made that initial connection. Now it's time to shift gears into your core nursing assessment. Your eyes, your ears, your hands, these are your most important tools right now. It's all about spotting those critical cues.
Let's start with the basics, right? Before you can make a plan, you have to know for sure what's going on. What specific signs are you looking for that tell you, yep, Anthony is definitely in the active stage of labor?
You're really looking for a mix of 4 key things here. You've got cervical dilation and effacement, the baby's fetal station, and of course, a good consistent contraction pattern. It's how all these signs come together that really confirms you're in active labor and gives you that full clinical picture.
Now, let's look at that fetal monitor. It's basically feeding you 2 crucial stories at once, the baby's heart rate and the uterine contractions. The real skill is seeing how they relate to each other. What is that fetal heart tracing telling you about how the baby is handling the stress of each contraction?
Seeing a Category 1 tracing, that's what we love to see. It's a reassuring sign. It's basically the baby giving you a thumbs up, saying, hey, I've got plenty of oxygen and I'm handling labor just fine. This is our happy baseline. It tells us that for now, things are looking good.
Okay, but here's the curveball. Your patient tells you something that doesn't quite fit the textbook. Anthony says his contractions don't go away. Wait a minute. Contractions are supposed to have a rest period, right? That little comment should make your critical thinking alarm go off. What could be happening here?
So you've gathered all these clues, you've got your data points. Now comes the most important part, making sense of it all. This is where you switch from just being an observer to being a real clinical decision maker.
All right, time to pull it all together. You know the stage of labor, you've seen the fetal tracing, and you've heard what the patient is telling you. So what needs your attention right now? If you could only do 3 things, what would they be?
Honestly, labor and delivery nursing is a constant juggling act. You've got to manage your patient's physical pain, keep a close eye on that baby's well-being, and provide that crucial emotional support. For Anthony and his partner, every single one of these is a top priority. You can't let any of them drop.
Let's zoom in on pain management for a second. At 5 centimeters, Anthony's right at a point where he's got to make a choice. The 2 main options, IV pain meds and an epidural, each have their own pros and cons. Your job is to break it down for him really clearly so he can make an informed choice that feels right for him.
We're going to switch gears for a moment to a skill that is every bit as critical as reading a fetal heart monitor, and that's inclusive communication. I promise you, how you talk to your patients is not a soft skill. It is a fundamental part of providing safe, effective care.
This is a question you should get in the habit of asking yourself after every single patient interaction. Seriously. It's not about just being nice. It's about actively showing respect for who they are. Did I use the right names? Did I use the right pronouns? Did I actually listen to what they wanted? Let me be really clear about this. Using affirming language is a clinical intervention. Getting a person's name and pronouns right isn't just polite, it actively lowers their stress and builds the trust you need to have a good therapeutic relationship. This is totally non-negotiable for safe, patient-centered care.
And hey, don't forget, you're not just caring for a patient, you're caring for a family. The partner is a huge part of the team, so you've got to actively bring them in, acknowledge them, ask them what they need, and keep them in the loop. This helps calm their fears and actually empowers them to be a better support person for Anthony.
So we've walked through the assessment, the analysis, the communication, the whole thing. Now it's time to pull it all together so you can put it into practice. The whole goal here was to get your mind warmed up and ready for that simulation room. And here it is.
The final and maybe the most important question of all. No clinical experience is ever perfect. Reflection is how we get better. So as you get ready to step into this simulation, think about what you just learned. What's one thing you're going to focus on? Your assessment, your communication, your support. Keep that one thing in your mind as you begin. Good luck.